Joining me now is Neera Tanden. She's president for Center for American Progress. They have a new proposal, Medicare Extra for All. We want to find out about it. Neera, thank you so much for joining us. We appreciate it.
Thanks so much for having me, Cenk.
All right. So first thing I want to do is talk about what it is, because it's relatively new, and I want people to find out about it. And then I want to ask you about the difference between that and Medicare for All, et cetera. So what does Medicare Extra for All mean?
Great. So Medicare Extra for All is a plan that covers everybody. It offers universal coverage. It expands on the Medicare program and ensures that newborns, all seniors, everyone who's uninsured today are auto-enrolled in the new Medicare program, a sort of beefed up Medicare program. And then ultimately, so basically everyone outside of employer-sponsored coverage today, except for veterans in the VA, goes into the Medicare program, and employees and who have coverage today and employer-sponsored plans can keep their plans if they want to, or they can go into the expanded Medicare plan.
So, Neera, is it fair to characterize this as a step between what we have now and Medicare for All?
You know, I think it's a lot more robust than just a step between, but so it's not a Medicare option. I should distinguish. There are a lot of candidates who are talking about making Medicare available to everyone, but this goes beyond this, beyond a Medicare option plan. This makes sure that everyone is covered. So coverage will be universal in the United States. And the kind of major difference between this and Medicare for All is, there are some differences, but a significant difference is that this plan provides people with employer-sponsored coverage the ability to keep their plans. Now, ultimately, and I think where we'd agree with single-payer advocates is that many people may think a Medicare option or the Medicare plan is better, and so they'll go into it. But this plan gives the choice to the employee.
So there's a couple of things that I want to ask about in regards to that. So you say it's universal coverage. Let me tell you the things that I'm concerned about.
Sure.
First of all, you have a mandate in the program, correct?
Yeah, everyone must be covered.
Yeah. So if they choose not to have insurance, then they're going to have a fine. Is that correct?
They can't choose not to have insurance. So everyone is auto-enrolled. Every person who doesn't have insurance is auto-enrolled in insurance. So there's no option to not have insurance, right? So a newborn, if you don't have insurance today, you're automatically enrolled into the Medicare program, and so there shouldn't be anyone who isn't insured, and that's very similar to Medicare for All. Everyone is automatically insured. So now, if you have coverage today through your employer, you can keep your coverage, but basically that's the only way that you're outside the system, or the VA. I should say we keep the current veterans VA system.
Right, that part's I understand is clear. So, but I want to understand this better. So let's say I'm switching jobs and I don't have insurance anymore. Does the government somehow find out? And if I haven't signed up, when do they auto enroll me, and what do they charge me?
Yeah, so the way it works is if you don't have insurance, you have a backup plan for insurance, right? So you go into the Medicare plan. Now, we do have a sliding scale premium. So for working class people, low income people, up to 200% of poverty, there are no costs to the system. And then premiums, you do pay a premium depending on your income above that. That does drive the affordability of our plan. So our plan costs a fraction of what single payer plans cost. So, if you're a person who's changing jobs and you're uninsured for a while, you have the Medicare plan as your backup. And ultimately, we haven't nailed down, we work on this in the legislation, we'd figure out a way through the tax code, just like in the ACA, that you pick up premiums. But you can't, our goal, and the goal we share with single payer advocates, is ensuring that every single person has health care.
So which leads to the next issue. There's still premiums, and there's presumably deductibles, obviously, in the private insurance situation that most of the country will still be enrolled in. And 29% of people right now do not pursue treatment because of costs. So I'm very concerned that a third of the country will still not be getting insurance because they're worried about their premiums, deductibles, or other charges that exist in this system.
Yeah, so I want to be really clear about this. The Medicare plan that we've devised is one that has free preventive benefits, mental health coverage. It's much stronger than the Medicare program itself. And in terms of the issues around premiums would never be. This program is much more generous than the Affordable Care Act. So premiums for even the highest earners would never be more than 10% of income. My take on this, and I think most healthcare experts would say, a lot of employees who have subpar coverage today would go into this plan, and ultimately, it may be that choose that this is a better plan than what they're getting. But if they're in a situation where this coverage is where they have subpar coverage or they're worried about affordability, this plan should really be there for them. There shouldn't be anyone at the end of the day who's sacrificing their own coverage because they can't afford it.
So Neera, that's where a lot of my concerns are, because
Sure.
it would maintain the current system. It would layer this on top of it. The current system does have, like I said, 29% of the country underusing their insurance because they're worried about the cost. It maintains those high costs. There is some bureaucracy in the things that you have to file depending on where your income level is, as you explained. So I'm concerned that you would put it out as a progressive option, and people will still have the high cost of private insurance that we're not getting rid of because that system is maintained overall, and still the majority of Americans would be in it. And we would layer in bureaucracy, and then that frustration would lead to people giving up on the system rather than the clean Medicare for all, which automatically gives them insurance with no premiums, no deductibles, et cetera.
Yeah, so that's single payer has no premiums and no deductibles, but there are costs associated. Now, we don't know what those costs are because the plans in Congress so far haven't spelled out those costs. But it's not fair to say that people will not be paying for single payer. Of course they would. You and I both know they'll be paying for it in some version. It's not paying through the premium, it's paying through the tax. And there are a lot of varied estimates about how much people will pay for that. Having said that, I absolutely agree that healthcare is a universal right, and that's why we tackle it. Now, on the idea of 29% doing this or 29% doing that, that's not the system we'll have when we have Medicare Extra for all in America. If we have Medicare Extra for all in America, 250 million Americans will be, and in the first phase of this, will be in healthcare. It will be in the Medicare program because you have seniors, you have newborns auto-enrolled, you have the entire individual market, including ACA, CHIP, and Medicaid into the new Medicare program. So that is a big expansion of coverage, Medicare coverage throughout the country. The only people outside of that system will be some share of employees who currently have health care. Now, they will have that option. If the Medicare program is better for them, they will choose it. And if it's not, they won't. Large employers will either go into the Medicare program, have their employees go into the Medicare program and pay a share of that, or they'll continue their coverage. At the end of the day, it will be up to the employees, not the employers. So I don't think it's fair, just to say, I don't think it's fair to compare our plan and say it's like the current system. And just to say, I do think we have to wrestle with the fact that 70% of Americans currently like their coverage, and through them that have employee-based coverage. So, and as you know, there are plenty of universal healthcare systems around the world, Germany, Switzerland, that maintain private coverage but have strong regulations of it, which our plan absolutely has strong insurance regulations of both. Obviously, the Medicare program has its own rules, but also private insurance to make sure it's competitive.
Yeah, so Neera, there's so much to get to, but let me just address some of the things that you just said. I want the audience to be clear. In terms of the coverage, you mentioned earlier that your program is stronger than Medicare. It does not cover more than Medicare for all, which is different than the current Medicare.
Yes, absolutely. That is 100% right. I am comparing it. I'm saying it's better than the current Medicare program. You're absolutely right about that.
Okay, and then when you get into how do you pay for it, the Medicare for all would reduce costs overall. Yes, you would pay higher taxes, but you would not have all the other costs associated. And one of the ways that it reduced costs in every other country is because it gets rid of the needless middleman, which is private insurance, the profits, the marketing, the executive pay, etc. So what I'm deeply concerned about is if we take a middle step and you don't get those tremendous cost savings and benefits of Medicare for all, then you're half jumping off a cliff and you get saddled with all the downsides and you don't get to the upsides, which leads to the politics of this situation, Neera. Do you think that if you do Medicare Extra for all politically, that it'll get any Republican votes?
Cenk, so there were a few assumptions I really want to just tackle, and then I'm totally happy to answer the question on Republican votes. One, just to say clearly, Germany has a system of universal health care that has highly regulated private insurance. Their administrative costs nationally are around 4%. Japan, similar situation. Switzerland, roughly 4 or 5%, much lower than our administrative costs, much closer to our Medicare administrative costs, and they have highly regulated private insurance markets. So the idea that our system is completely fragmented, we do not have enough regulation, we do not have national regulation of insurance, that leads to large scale administrative costs. Under Medicare Extra for all, you'd have much lower administrative costs than you have under the current system. So I just need to be clear about that. It is the case that there are low administrative costs in Medicare Extra, in Medicare for all plans. At the same time, Medicare Extra for all costs to the taxpayer a fraction of what Medicare for all costs. And the reason is that we ensure employers make their contribution to this. We can finance our system on essentially taxes on the wealthy. The vast majority of taxes raised are taxes on high income earners. That's not the case for Medicare for all. However, I completely respect advocates for Medicare for all. These are just two different visions of how to get there. My own view is that politically, and getting to the politics of this, Medicare Extra for all, our version has support of 75% of Americans because a lot of people want the ability to keep their employer-based coverage. As I said, 70% of people who have employer-based coverage today like their plans. So we think that is an important thing. And actually, when you ask Democratic voters between being able to keep your insurance or a single payer plan where everyone is in a Medicare program, and Medicare is a very popular program. So when you ask those two issues, it's 54-40 amongst Democrats who support a plan like ours. So, but again, I want to say, I think these are two different visions of how to get to universal health care. I completely respect the folks who want single payer plans. I just think it's important for us to recognize that there are multiple ways to get to the goal. And as internationally, there are systems like Germany, which are still maintain private insurance.
Okay, Neera,
there are systems like the UK that don't.
Okay, I've got to ask two more questions. And,
sure.
I'm sorry,
I don't mean to go on. I can just walk out on. So I apologize for going on and on.
Right, okay, and there was a lot of presuppositions there that I don't necessarily agree with. And I'm deeply concerned that it maintains the costs of the current system. Okay, but politically, I don't think you're going to get any Republican votes. So compromising from the beginning, to me, doesn't seem like it's a great idea. Medicare for all already polls at 70%, so it's already deeply popular. And then in your plan, it takes a long time to eventually transition, if we're going to a complete Medicare for all system, which gives the Republicans 1,000 chances to vote to win any elections and undo it. Are you also not concerned about that?
So I think there's a fundamental misunderstanding about or concerns about single payer. Obviously, the right is concerned about single payer, but in public research and public polls today, support for single payer drops dramatically. I mean, support for Medicare for all drops dramatically when you tell people that it would eliminate private insurance. As you know, it drops well below 50% when people understand that it ends private insurance. Now, I think a lot of people in America think of Medicare for all, and this is not right. Medicare for all is the bill itself is single payer, but a lot of people are hearing Medicare for all and thinking it's basically an option for people, which is neither our plan nor Medicare for all itself. So I think there is a misunderstanding about this. The concern I have about Medicare for all is not Republican attacks on it. Republicans aren't going to like our plan, and they're not going to like Medicare for all. My concern is public opposition, the lack of even full Democratic support for a plan that that eliminates private insurance. Because there are people who, again, the employer-based system right now. And so I'm worried about that public opposition, not Republican opposition. I do think our plan has more Republican support than a single payer plan, but that is not the reason. I don't think our plan is something Republicans are going to buy off on. I think our plan is something that has greater public support as registered by current polls of Medicare for all, which are at 50% or less.
Right.
Or no, around 50% or slightly more. Today there was a morning consult poll that showed it was 50%.
Neera, I think that's a huge misnomer because they say, well, if you tell people you're going to lose your private insurance, the polling drops. Yes, but if you told them you're going to have insurance that's better and that doesn't have premiums or deductibles, the numbers would go back up.
But they say, just to be clear about this in the polling, I totally hear you. In the polling, it says ends private insurance, but has Medicare, which is a very popular brand for people. Everyone goes into Medicare. So no polling question is perfect. But I regardless of the polls, I think there is a public concern about people losing the healthcare plan that they've already relied on.
All right, super last thing is really easy question. It's just a simple, does Medicare Extra for all cover undocumented immigrants?
Our plan, this is something we're working on with Congress. Our plan hasn't covered undocumented, but that's something we're working on with Congress. Undocumented people, but that's what we're working on with Congress.
Okay, Neera Tanden, President for Center for American Progress. Thank you so much for coming on and explaining this and having a discussion about it. We appreciate it.
Thank you so much for having me.